Hello everyone, welcome to today's webinar where we will be thinking about a different approach to delivering services in children's social care. My name's Ryan Wise and I'm a social worker based at the Social Care Institute for Excellence, and I'm joined by a stellar lineup today here in the room, but also on the chat we can see we've got people from Bangor, North Yorkshire, London and as far as Australia. So welcome to Leanne from Australia, great commitment there. But I'm just going to go around the room here and ask the panel to introduce themselves.
Hi, my name's Dean Lawrence and I'm Head of Service for Children in Need in Warrington.
Hi everyone, my name's Katie Rose. I'm a Programme Manager at the Centre for Public Impact, which is the not-for-profit foundation that was involved in the blueprint.
Hi everyone, I'm Michaela Berry and I'm a Practice Supervisor in a local authority in the East Midlands.
I'm Dan Comarch, I'm a team manager in a safeguarding service in South London.
Hi everyone, I'm Jerome Harvey-Ajay and I'm the co-founder of the Topi project and Youth and Participation Officer at the Mayor's Office, City Hall.
Great, thank you everyone. So we've got 1 hour today, and if you haven't joined a SCIE webinar before, the first thing to tell you is that we want this to be a conversation and not a presentation. So we do have slides, but they're more of a guide. And please do make lots of comments and ask lots of questions because the plan is to take regular pauses to really bring your voice into the room. And after the webinar, we'll send you a link to the recording where you can access all the slides and the conversation from the chat box. So, we referred to a new approach to describe what we're going to talk you through today, but we might also use the term blueprint. And I want to just offer some clarity from the outset. So the new approach that we're going to talk you through has been set out in a report which was launched in December, which was called A Blueprint for Children's Social Care. And we use the term blueprint because we were setting out how a local authority could start to think about implementing this new approach. So this approach that we're going to talk about, it was shaped and designed following connecting with over 80 people, including organisations and leaders from the sector. And what we're going to do today, we're going to start with Michaela, who will be briefly outlining the problem that this approach is intended to address, before Katie will talk us through what this approach looks like. Dan, Jerome and Dean will be talking us through some of the benefits and what to bear in mind when thinking about possibly implementing this, and importantly, how this can be co-produced with children and families. So the focus of the webinar will be specifically on the approach. Any queries that you might have that fall outside of this, please do get in touch following the webinar. So let's get started. Michaela, can I hand over to you to talk us through some of the issues that the approach was looking to address?
Thanks Ryan. So the problems the blueprint is trying to tackle are not new and are in many ways getting worse and need a radically different solution. So there's currently a culture of mistrust of social workers that exists, and this continues to manifest itself in several ways. Too many forms and procedures taking up the vast majority of social workers' time. There are layers and layers of management, and whilst at the same time there are significant shortages of social workers who have to battle caseloads that are too high, and a command and control culture that focuses on data, and this de-skills social workers and undermines their confidence and also takes managers away from actually supporting social workers in their role. So to really tackle those issues, there were some key values that we wanted to design into the blueprint. At the heart of the approach outlined in the blueprint are two fundamental principles that propose structural changes to devolve decision making and enable social workers' relationships with children and families. So what I find really exciting is that the blueprint is entirely designed around a very clear understanding of how crucial the relationships between social workers and children and families are. Over the years, with children and families, I've been part of achieving and seen other social workers achieve amazing outcomes, down to the power of relationships and not paperwork and process. So relationships are prioritised in the blueprint. The second fundamental principle is that social workers should be given the responsibility and decision-making power they need to support families. So in this approach, social workers are trusted. Social workers who know the families and the context they are working in are far better placed to make appropriate decisions with the family. The blueprint offers a chance to remove a huge source of frustration and delay caused by having to navigate a decision-making chain, very often for things as straightforward as a train ticket. Okay. I'll
Thanks,
pass on.
Michaela. And it'd be really great to hear what people think about our framing of the problem, really. So continue with your comments, and we're going to move on to Katie now, who's going to talk us through an approach that can address this.
Yeah, so as Michaela said, we wanted to think about how a local authority might do children's social care differently to really prioritise those two principles. And we wanted to do it in a way that would allow a local authority to spend no more money doing this, and also that would comply with existing regulation and legislation that exists. So at the heart of the model, as you can see on the slide now, or the approach I should say, are patch-based family-facing teams of practitioners who all work with children and families. So we have a team of 8 social workers who are former social workers in the current system and former team managers, and everyone holds cases with children and families. Teams work on cases from a geographic patch and hold cases throughout all levels of risk, so completing the initial assessment to a child being looked after. The 8 social workers in the team have mixed experience and specialities to enable the right level of experience and specialism to be accessible for all team members. The other really important thing to say is that the way that peer oversight and supervision happens in this approach is very much a peer-led model. So different team members can offer that oversight and supervision to each other because they have that necessary experience within the team. Now, it's important to say, you'll notice there's no manager of the teams in the approach here, but that does not mean the teams are not managed. They are self-managed, and because they have the experience of former managers in the system, they are enabled to do that. The other thing to say, and then we can take any questions, is if you go to the next slide, the rest of the system around these teams is set up purely to help social workers do their best job and spend time with children and families. So 4 teams make up the support structure that a local authority can provide these teams. The first is a referral team, so handling all contacts and referrals and allocating those to the necessary geographic patch of social workers. The second is the enabler team, and they allow social workers to really prioritise spending time with children and families by helping them run their teams the most efficiently and effectively as possible. The insight team is the third pillar of the support system, and they provide the necessary expert oversight and also just advice to teams, but it's very much on request from teams, so it allows them to have that outside, independent, experienced voice that they can access at any time. And then lastly, there's the strategy team, and this team exists, it's formed of previous local authority leadership, but is in a very streamlined sense, and they exist to provide the necessary checks and balances on those decisions that are the most important for children and families, and also that cost the most money and have the most resource implications. So we can talk about what those are in a second, but we've defined them as kind of 3 main things. So whether there's a change in placement for a child, and also then whether obviously a child is taken into care or whether an independent assessment needs to be conducted.
Can I just ask a question there, Katie, and open this up to the room as well, kind of looking at Dan and Michaela because you're in my eyesight. In terms of thinking about where we are now, more generally, in the sector and what this is proposing, what are the kind of key differences, like the headlines that stand out for you?
I think predominantly it's not about removing managers per se, it's about increasing leadership and support in a way that is closely linked and closely aligned with families. And there are a lot of people involved in children's social care. I think some of the numbers that we looked at as part of the completing of this approach meant that 1 in 3 social workers employed in England are not having direct contact with family, and they're the most knowledgeable, experienced practitioners moving into management, moving into academia, and we think that should be different because we think that can make a difference. The difference isn't process and policy, it's relationships, we all know that.
And I'm just going to come to a question from Michael there. It's more of a statement and just to hear some reflections on that. So Michael's put that the current policy system of accountability means that this form of innovative practice cannot be in place without some form of relaxation of regulation. Any thoughts from the room on that?
Yeah, so I can start. We very much wanted to design this approach within the current existing regulation and legislation so that a local authority could do this tomorrow. However, it very much acknowledges that there are a lot of restrictions in terms of regulation and legislation and what they do to, the restrictions they put on social workers. Maybe Michaela or Dan can comment on that, they're more accurately placed. But I think we've tried to put forward a approach that could be done tomorrow whilst acknowledging that some relaxation of those regulations may promote the benefits more so.
Okay, and we're great to see so many questions coming through, so I'll do my best to keep track. So I'll just share some questions for the room to see what people think. So there's a question there about social workers kind of accessing funding resources themselves, so how much kind of autonomy they might have. There's a question there about progression in terms of how social workers will progress, and there's something about co-production as well, which we are going to come on to actually in a few more slides, so I might save that for a minute. So could we focus on that kind of funding question and progression first of all?
Can I answer that? I think we've come to a model where we think progression means management, and actually social work is a really complicated task, and to be a really good social worker takes a really long time. It takes a high level of skill, a high level of training, and should we be paying the most skillful people the same amount of money, but should we be having those people having contact with family? And my view is yes, we should.
And just to come in on that point as well, I mean, I've been doing a lot of reflecting on this, and having worked in other multidisciplinary teams and thinking about psychiatry or clinical psychologists or our colleagues in CAM, all other professions, a lot of other professions have senior managers who still hold clinical positions and are working with children and families. My view very much is that that's something that we should see in this model. What I really like about this, when it talks about the strategy team, that there's opportunities for people to move between different parts of the system. So even as a head of service, I see no reason why, if it's something that I think that I want to do, why I would not be able to go into a family-facing team myself.
Yeah. You wouldn't get in dentistry a professor of dentistry that hasn't looked in somebody's mouth for 20 years. In social work, that's a very common occurrence.
And we've got a question there about two questions about supervision. So we've got a question there about kind of where would supervision lie for social workers in this approach, and also how are the social workers that are delivering peer supervision prepared for this, and also would there be group supervision rather than one-to-one supervision? So could the room kind of talk a bit about supervision in this context?
I think what's in the model that's outlined in the blueprint, there's actually more supervision for social workers than currently they experience. I don't know if Katie, you've got the actual figures in there.
Yeah, so when we tested this with a local authority, we did a test of if they transferred their current system to what's outlined in the blueprint. We found that because they had so much more time, they could actually increase the time spent in meetings and supervisions by 46%. So there would actually be more time for those team meetings and more time to talk about cases, which is what we heard from social workers was the biggest value of a manager. So we're definitely not trying to reduce in any way that ability to reflect on cases and decisions made that we heard was so important.
And there's the role of the insight team. Could you tell us a bit more about how the insight team might be involved in supervision?
Yeah, so the reason we thought that the insight team were a key pillar of the support structure that's needed to help social workers do their best work with children and families was because we also heard that often what was really helpful is having a independent expert to just help you reflect on cases and decisions. And so we wanted there to be a team that social workers in these family-facing teams could access to ask about decisions that they'd made and reflect on them if any mistakes were made. And also for the insight team to often just come into teams and ask and see how decisions were being discussed and give any coaching that might be needed for these social workers in family-facing teams.
And there's a question here from Amanda about how does escalation work when partners or social workers have concerns? And correct me if I'm wrong, Amanda, my interpretation of that is because there is this idea of self-management, there's something that's alluded to in the blueprint about lone wolf, so there might be a link there. I don't know if someone could tell us a bit more about kind of worries around escalation in the context of self-management.
Yeah, I can share my reflections, and then anyone else is welcome. I think in terms of escalation for the approach that we laid out, the strategy team still provide that necessary checks and balance on the three most important decisions made for a child and family. So whether they're going to be initiated care proceedings, whether there's going to be conduction of an independent assessment, and whether there's a change or they want to place a child. So they provide the necessary checks and balances in the way that they do in the current system. In terms of escalation about a mistake or any decision that a child or family may not agree with, or any issue, it is within the team's remit of control to do that, and there's multiple functions they can use to escalate. So they can go to the insight team if they need advice, they can go to the strategy team if they need any kind of sign off or anything like that for any decision that sits in those three. But it is, as Michaela said, the principle of this is based on trust. So it's not based on management and prohibiting, it's based on enabling, and it's based on trying to give social workers the freedom and responsibility that we think they deserve.
I think actually quality assurance does actually increase in this model because, as Katie said, there is more supervision and oversight than there is currently. So, yeah.
It sounds like there's something about it's more of a shift in culture and seeing things differently. So perhaps how we see escalation in the traditional terms might change.
And I think we have to question whether escalation is a really effective way of dealing with a problem when we can have a discussion with the person, and sometimes there will always be issues that need to be managed outside of the person, but this would kind of create a situation where you have to have a discussion, you have to have difficult conversations, and that's what social work, really, really good social work is about.
And I just want to bring Jerome in if I can. There's a question there from Solly about what do you think, Jerome, about the preparatory work, that was hard to say, which would need to be done with multi-agency partners or communities to kind of help them see working in a different way like this, to kind of doing that culture. What would you say about that? Your own thoughts?
I think from my perspective, it's just about a shift in a mindset. So we are stuck in a fear-based system. And the meaning that a lot of social workers go into work with is fear-based. It's about how do I protect myself? And actually, this is when you shift that to a love-based approach, which is about actually we're saving lives here, we're changing lives, we're nurturing. That whole approach now is not about protecting me, it's about protecting the child and nurturing, growing the child. So sometimes it's just a shift in how you do team meetings. It's about like simplistic things like getting plants in your office, or giving your team a timeout. Like within the day you get an hour to do growth time, which is about growing in yourself, reflection, giving yourself time to just really, and these things are really simple. Or just within your calendars, actually, how do you build relationships in your calendars? All right, do you know every young person's birthday? Do you know if they've got an important date? Have you checked in on your young people? Have you checked in on your staff? But these little things that are just simple shifts, but it doesn't take a lot of energy. It just takes simplistic thinking and more caring thinking, giving time to think.
Great. And two questions that perhaps come to Katie in a sec about performance issues and how they would be handled in the team. But first of all, there's a question there about how do you establish the right culture within the team for this to work in a new way? And I wonder, Dean, could you talk a bit about that kind of culture within teams?
I mean, it's interesting because I think it's not a challenge, but I think the thing that I'm most fascinated about is about how the culture will develop. Because actually, at the moment, if we're going to create a team, say for example, in the family-facing team, you might have a service manager, team manager, different people go into that. They have a history. They've got a pre-life before they've gone into that system. So how do we break down and create a clean slate where people feel actually, well, you used to be a team manager, you used to be a service manager, but now we're all equal. And I think that the critical part, particularly in a pilot, is making sure that we're picking, or in the recruitment process, is getting the fit right, particularly for a pilot, because you're rolling it out so that the people within that are going to be really able to reflect on their position. So say, for example, as me as a head of service, if I was to go into that family-facing team, recognising the impact that I have as part of that, I think that's definitely a starting point for me. If anyone else has got any other thoughts.
I'll just add that one of the things I like loads of things about the blueprint, but one of them in particular is that the members of the strategy strategy team, one of their key roles is to protect and promote the culture within a local authority for this to flourish. So I think that's kind of been written into the blueprint as well, understanding that that's going to be an issue and something that needs really proactive management.
I think just coming back to one other thing that I think is really crucial, and I think I was part of the Hackney Reclaiming Social Work, and one of the things that we noticed when the units came together, it wasn't just about the impact on children and families, but it was about how each individual unit functioned, and it talks about different functions within this, like team treasurer. I think that there's a place and a role for a team observer taking the balcony position and constantly observing, and people taking it in turns to observe and notice what's going on. And that could be a function that's performed by the insight team, but also if I was in that team, that's something that I would be suggesting that we might want to do. But that's for each team to decide how they want to check their culture themselves.
I love that idea.
So I'm just going to come to two ideas first of all. So there's one from Simon there that we're going to touch on in a minute, and there was also a previous question about performance issues. So we're going to answer that one about performance issues, and also Simon's question there about so team managers and IROs now, if these posts will have casework responsibility, who will undertake tasks like managing complaints and chairing reviews? So I'm going to hand over to Katie for those two, if that's all right.
Yeah, so on performance issues, I think because the way the approach is structured, we're actually bringing a lot of the experience that currently exists in the higher levels of management right now into teams to work with children and families. So actually, there is still the kind of oversight on the performance of each other, but it's very much done in like a teamly way. And you want to help each other, enable each other, because you're part of the same team and you're all working with children and families, live and also then together. So I think there is still, and as Michaela said, when we tested this with the local authority, we found that time spent in those team meetings could actually increase by 46%. So there very much is more time to like manage performance, if you want to use that phrase. And as Dean said, the enabler team and the insight team are there to help teams run effectively and efficiently and provide the best practice. So you've still got a lot of what we believe management provides. It's just not in a vertical structure, it's in more of a horizontal, teamly, collaborative structure. I don't know if anyone else wants to.
Sorry. What we observed when we went to the Netherlands was self-managing teams. And because there isn't a hierarchical manager, doesn't mean you're not accountable. You're accountable to your peers, and that is a very difficult thing. But what our colleagues in the Netherlands said was actually it was a really effective way of managing.
I just find it quite interesting that we're looking at this in terms of performance. Again, for me, it's like the fear of, it's like that there's a lack of underlying trust, and for me, it's about we have to really shift from that, because that you've been trained for how many years to do this job, so we should be able to trust that you've gone through a rigorous process and you should be able to do the job. Holding each other accountable is a beautiful thing if you've got the time, the energy. When you're doing the work you're doing, it's uplifting, so and when you can have an honest conversation and someone knows the intention, like actually we're doing this for the betterment of all of us, we're learning from a situation rather than blame and shame culture, which we need to remove away. And I guess, like, for me, it's like it's more about learning processes. So like in terms of when you have something, having a reflection, and when you have an observer that says, look, I noticed that maybe you didn't communicate in the way you could have because of the stress of the trauma. We're dealing with, this is a human job, and we're dealing with kids with trauma. And imagine you've got even 14 young people who've got all trauma. That's going to have an impact on you. So it's looking at how you manage that individual as a human, because this is a human job, and you're expected to do it within a limited time. So you've got 14 young people that you're dealing with, and you can't. The current system doesn't allow you to be human, and that's the problem, is that you can't even talk about yourself as a human being. Like, I've been on holiday, or I do this, and it's like, well, these kids are not silly. If they wanted to find out this stuff, they could. Yeah. We've got the power of the internet. So it's like getting back to how do we build those human relationships where it's just enough to help, because we're divulging into their lives, but we're not giving anything back, and this needs to be an exchange, and that's the same with the teams. If it's reflected in the teams, it will reflect on the young people, and it's so that's what we need to build into.
I think that's right, and me and Michaela spoke as part of writing this, is very much, we spoke to a lot of team managers that actually said, the vast majority of social workers they work with are brilliant, and actually the current systems are really prohibiting doing their best work.
It actually makes social workers look incompetent. They're so overworked and have caseloads that are so high that they actually appear incompetent, which falls into a vicious circle of them not being trusted. But it isn't that in fact at all. It's just that they have completely unmanageable workloads. I think the vast majority of social workers are wholly trustworthy and want to do the best job they can for children and families.
Okay. So I just wanted to offer a point of clarity, because I saw a couple of comments after what Dean was saying about a potential pilot. So just to be clear, this hasn't been piloted as yet. So where we're up to, the report, the blueprint that we referred to, was launched in December. And with kind of Christmas and everything, people being off, this webinar is a way of kind of reconnecting with what was written to see what people think and to kind of carry on the conversation. So nothing's been implemented as yet. So we're gonna move on, but we're still gonna take questions, and we're not doing too well keeping up to date with all the questions, but we will try. I think there's just for the panel in the room to note that I think there's a strong sense from most recent comments about how do we bring people alongside. So there's a lot of comments about partners, the Department for Education, Directors of Children's Services, councils, community groups. So I think there's a lot about that, and we're going to talk a bit more about implementation hypothetically now. So if the panel can keep that in mind, that would be really helpful. But we're going to just first start with Dan, who's going to talk us a bit through the benefits of what this could achieve, perhaps.
For me, the thing that made this model really attractive is conditions for working that mean that social workers are able to stay in really, really complicated jobs. We know across the country that we struggle with recruitment and retention of social workers, particularly in child protection kind of settings. And for children and families, what they tell us is that they're telling you their most personal, intimate parts of their life. They're sharing their fears and their vulnerabilities, and then they have to share that with another person and another person and another person. So how can we bring about a system change that helps people stay in the profession, helps them to access support, and to bring back the kind of the love, as Jerome was saying, into the work, which is the part that actually makes the difference. And that means spending more time with children. It's really important to have policies and procedures about how we safeguard our children and young people in our communities. But there is so much legislation in place within a children's social work context that you have to be an expert in managing the legislation, but we want people to be experts in managing the relationships and connecting with people. And somewhere along the way, my view and my experience over the last 15 years is that legislation has gotten developed where the response needs to be a human relationship response. So if there's an issue, we create some kind of document or process or procedure. That in itself doesn't mean that the problem becomes solved. It makes us feel kind of happy because we put down something on paper, but the issues are predominantly relational issues and they don't get resolved. So this, for me, offers the opportunity for relationships, not just between children and families and social workers, but also social workers and partner agencies. Can we have a discussion with the police? Can we have a discussion with schools? Can we have a dialogue before we have to fill out 87A, fill out a form, do this? Let's have a dialogue. Let's try and make sense of things together before we implement processes.
Sorry to interrupt you there, Dan. Just a point of clarity. So I know it says there were significant benefits when this approach was tested with the local authority, which appears to be a massive contradiction to what I just said. But just to let you know, what we did as part of the writing of the report was we worked with a local authority using their data to think about if we applied this approach, what would be the possible outcomes. So quite hypothetical and quite just using the data, so not actually doing it in real life. And as you can see, I know it's a bit small on the screen, but there are the benefits that Dan started to talk us through. Sorry about that, Dan, over to you.
And just to say that there was some pilots with adult services for some of the questions about unison and 2P and that. The other thing that really kind of attracted me to the idea is a reduction in caseloads. If you are a prison, you know when you're full because you run out of beds. If you're a hospital, you know when you're full because you run out of beds. If you're a hotel, you know when you're full because you've got no vacancies left. How many children can social workers know and understand and hold in mind? This is an issue that we've skirted around a lot as a profession. We don't have an opinion or a position about what is the right number of children. The fundamental difference with the Beurtsel model in the Netherlands is it's a national health model. So the Beurtsel nurses get a fixed fee from the national health system or insurance system for each person. So if there are 700 people that need services, there's 700 pots of money that then mean other Beurtsels can kind of sprout up and meet those needs. That's not obviously comparable here, but we have to say how much time are we spending with children? How much of an impact can we have if we're seeing one child every 4 weeks and we've got a caseload of 40 children?
Anyone want to add anything there about the potential benefits? So what we've got there is that there's more kind of relationships, opportunity to spend more consistent time with people and stronger relationships. There's greater time spent with children and families. So increasing from 16% to 25%. There could be a reduction in caseloads because you have more social workers actually working directly with children and families. And like Dan said before, 1 in 3 social workers do not actually directly work with children and families. They're more involved in the management of other social workers and in the system.
I just want to come in at this point, which I think as well is one of the added benefits. I noticed earlier in the stream somebody was talking about what happens with ASYEs, and I just think that this is such a valuable model in terms of development of staff. You know, if you think about having a range of people that might be from 20 years qualified to ASYE, that whole principle of modelling, practice, learning from each other, I just think it's just such a huge opportunity. If I was an ASYE, I'd want that, that's where I would want to be, because you're watching and observing and constantly having conversations about cases. I just think that's one of the things for me, definitely.
I think that's right. And so we worked with hundreds of social workers as part of this, and actually that was actually what we heard from them as one of the most valuable things, that they, when they had those reflective conversations with their manager, which wasn't as much as we predict could be the case with this approach, it was hearing of what they would have done and what they would do. But the benefit of this is that you can actually, that can be all the time, because your former manager is working with cases, so they can share constant reflections on how they're dealing with children and families and what you can do better. Yeah,
I think also what Bex just said there, and I think it's really pertinent as well, it's about also, it's not all about about anyone who's 20 years qualified, but also the huge experience that ASYEs bring with them as well, and that everybody's there, and that everyone, that degree of equality within the team. I like that. Thanks, Beck.
And can I just ask us through the question from Lorraine there, which I think is an excellent one about demand. So we all know, like kind of Dan was alluding to there, that the system's stretched. We're at breaking point. We might have passed breaking point. So it's all well and good saying obviously self-managing teams, but what if demand becomes too high or too strong? What do we do in that context?
And demand seems to be going up because of.
And what do we do in the current context is the question. So we're working on the premise we're not going to get any additional resources from central government. This outlines how, with the same group and function within a local authority, the case work and the case responsibility can be dispersed in a different way. There's always the vulnerability that it gets cut and cut and cut, but again, what my kind of hypothesis would be is that when we work with our partner agencies and we connect with them and we have a relationship with them, we're able to intervene at an earlier time, and we're able to intervene at the right time. At the moment, what children and families and partners say to us is, it's so difficult to get support. And then when you do get support, you get so much support, but it's at the wrong time.
Yeah, I think that's right. And just to add to that, I think Dan's right. We very much thought about this approach within the current, resource requirements and existing regulation and legislation. So this is very much, we do believe that we can reduce the average caseload for a social worker, because you're those former managers, as 1 in 3, are now working with children and families directly. There is also the ability, because you're working in such a collaborative team, to, if there is an ASYE that needs less cases in a former team manager that's more experienced and can take on more, so there is that ability to flex because you've got that decision-making authority within the team.
And there's a question there from Joe, Katie. Do you mind just clarifying about the kind of costs that were set out in the blueprint and how that figures with what we just said there?
Yeah, sure. So what I'm saying when it doesn't cost any more money for a local authority to run their system like this is if they transferred their entire system to the way that is outlined in the blueprint, it wouldn't cost any more money. To pilot this alongside an existing system, so you have to run into 2 systems at the same time, that we predict would be around 5 to 7 million. That said, that is not out of kilter with what an innovation program or anything like that the Department for Education has said before.
Brilliant. So we're going to kind of just continue the conversation. Couldn't get my words out there. I'm too excited. So we're going to kind of think about implementation. So what do we have to think about? So we're not kind of saying that this is going to happen, but obviously just taking that conversation further, what would we have to bear in mind and what would we have to think about? And the first thing we want to kind of talk about today is about co-production. So thinking about if a local area was going to implement this or think about implementing this, how would you involve children and families and how would you kind of take a co-productive approach? I'm just going to go on to Jerome there to kind of start off with some ideas, if that's all right.
Well, in anything, a lot of the time we make decisions about young people, not with young people. So I'm actually developing a toolkit, a participation toolkit, which is looking at how organisations involve young people in the design, the delivery and the development of their services. Because a lot of the time where they're making loads of decisions, doing all these things for families, and they're like, well, we didn't want that, you didn't even ask us. So you start with asking the question. I'm also quite aware that the resources we have, so we're in a place where technology is advanced so amazingly, but our systems are so backdated. So there is because I've been speaking to a few young people about how do you think we can give social workers their time back? And they were like, well, why don't they use WhatsApp? Why don't they instead of writing their files, why can't they do an audio file? Speaking about how their day went, and that just cuts time. And actually, social workers would welcome that. And why can't they use pictures instead of always having words? And so it's like getting creative. And because at the end of the day, what is that work you're doing for? Is it for you, or is it for the young person to reflect on their journey of who they are? And it's actually for the young person. So why don't we incorporate some of these ideas around? And that's what frees up your time. And then the other side of it is, so young people said to me, they understand that social workers are very busy, but what they want is quality of time. So it doesn't matter how much time, but it's about the quality of time. So when you're in this meeting with me, you are present. And the problem is that a lot of social workers will come in and not be present because they've got other priorities. So it's giving them the skills and the tools to come into a meeting and be present and be able to show up within that hour, and that young person be like, thank you, and they're the little shifts. And like being involved in our Christmas Day project, what I learned from that was that we were led by the young people, and then we created a template. So then, and that's the other side of it, is that creating things that people don't have to work too hard to kind of say, we can implement that. And that's what's great about this, is that people can actually take it as a template and say, yeah, let's start looking at how we can implement that within our, and then making sure we check in with families and young people about, would this work? So we're not wasting money, time, resource.
So just to kind of not put you on the spot too much there, but like you said there that you see this as kind of a template. So do you see, like, could you tell us a bit more about that? How you, if it was you and you went about this, that you would you take this in kind of obviously in a digestible format?
So if we look at the 5 key benefits, for instance, like, okay, we look at time. So for me, I'd look at, okay, how much time, if we look at how many young people you've got, how much time have you got in a week? And let's chunk it. So we have to make sure you check in on these young people within this time, and then we would give them the right questions. So these are the kind of questions you can be asking that are nurturing questions. It's not about, I need to tick a box to protect myself. It's about, actually, how are you? But what's missing in life right now? What can we add? How can we add value? These different questions that are more kind of like, they actually care about me. I'm not a caseload, I'm a human. I'm not going to a placement, I'm going to a home. You know, these little language shifts, even the language we use is conditioned. I was in care, and I definitely felt not having a home until I got home, when I left care. And that was sad, because you're taken away from your parents, and then you're told we're going to protect you, and actually a lot of kids don't feel protected. So the quality of assurance is about, again, having the time and the tools to be able to check in on your workers to see, how are you? You know, you're dealing with a lot. That was just heavy. Do you want to just take a breather? You know, and that's what happens, is that it's like a lot of firefighting, and then you don't get a break. And it's just it's that kind of nurturing environment where workers can support each other and say, you know what, I recognise, here's a coffee. Or there's a little thing that we do, Guardian Angels, which is basically everyone pulls a name out of a hat, and you have to look after someone, but they're not meant to know. So you do little like nice things for your workers to help them to kind of increase the vibe.
That's a great idea.
And it's little things like that we don't even realise that has a shift, because you become responsible for each other. And so and then also sometimes we have skills that we're not able to use in our workplace. So for instance, someone might be very creative, a social worker, but they don't get to use that skill. It's like, wait, hey, young people like that. Let's use that. Or I can play the guitar, or you know, like roaming in on what people have outside of this, because that's the human element that actually young people will truly connect to.
Okay. And then Katie, I just want to bring you in, kind of following Jerome's points about kind of, I think Beck asked an early question about kind of co-production with what's been done so far. So do you mind talking us through that? Has this been co-produced, or what might be the intention going forward? Like your thoughts on that, if that's all right.
Sure. So we very much worked with social workers to develop this, but we've said throughout, and I hope it's very clear in the blueprint, because it was very much the intention, that when this is going to be piloted or done in any local authority context, we would want to work within that context with the social workers and the team managers and the senior leadership in that context, as well as crucially the children and families. So what we've tried to do here is formalise an idea and bring it to life based on those principles that Michaela talked about earlier around, you know, meaningful relationships, as Jerome said, is so important, and increasing more time and, you know, having decision-making power where it should be located, which is where, you know, next to the children and family. But if this is going to be done in any local authority context, we would very much want to think about how to bespokely design it there.
Yeah. I think that brings on quite nicely to Dean's point. What Dean's going to talk to us about is a bit about kind of thinking about local context. So every area, every local authority, 152 of them, the practice looks differently in every single area, and the experiences of children, families, social workers, practitioners is different. So I really recognise Katie's point there about this would have to be created and taken as a template, and the community would have to be engaged to think about what that would look like there. So I wonder, Dean, if you could talk us a bit about that, and also kind of your thoughts about what this might look like in your context.
Okay, yeah, no, absolutely. You'll see here how I've tried to break it down is I've tried to look at the sort of the wider philosophical, cultural considerations, and then sort of looked at some of the more practical, logistical, day-to-day operational stuff and how that would fit in practice. And it's interesting because, you know, the blueprint talks about a radical approach. And actually, if you think about what a lot of local authorities are doing and what the blueprint actually says, I think a lot of local authorities are a long way along the journey in terms of actually what they're currently doing in terms of their own existing models and approaches to this. You know, the blueprint talks about lots of different examples from lots of other local authorities, and I think, you know, from our local context, you know, I see this as an extension of the work that we're already doing, and it's an opportunity for us. You know, it really is like it brings an exciting new dimension with self-managing teams. But I think for other local authorities, I mean, it's thinking about, well, where is the golden thread in the different things that you're doing? You know, where I'm based, it knows about relationship-based practice model, you know, and all the different things that we're doing. You know, we're doing No Wrong Door, which is again a similar principle. Some of the things that it talks about in the blueprint. The most important thing for us is about that thread, and that not just doing something for the sake of doing it, but having the wider connectivity across the system, I think, is really important to begin with. And then like getting buy-in across the local authority and across the wider partnership. I know, Jerome, you talked about the children and families element of this, but I just think, and when we talk, I think talking about all layers of the organisation and about how to, at what point to involve people in developing the model. Actually, if you think about a typical hierarchy from the DCS down to an admin grade person, actually, how do we involve a typically lower grade admin worker in terms of helping us develop and think about the enabler team and what their role is going to be, it being a truly organisation-wide debate and discussion about how we make this work. And I think we have to accept that there will be challenges along the way. And I was telling somebody yesterday that I was coming to do this and that we were really excited about the opportunities that this might bring for us. And they said, "Oh, you're brave." And I was like, but that's what you need. You need to have a bit of, you need to be brave, and you need to be able to fight back when the system is challenging, and be able to have confidence about having practice confidence. And again, me as a head of service being able to say, actually, I've got faith and trust in our social workers and our managers that we can make this work. And where there is resistance about doing that. And I think just one other thing before I move on is about the wider partnerships. So we're really fortunate to have a really strong safeguarding partnership, and already starting to have those conversations about, well, what does that mean for them, our CCG, CAMS and partners, just getting the debate going. It's about just the momentum around it. So that's certainly for us in terms of the cultural shift. I think some of the practical and logistical arrangements, we've already talked a bit about what self-management might look like in practice. And I'm absolutely fascinated by what that might look like. And debates that I've had with different local authorities that have considered doing this or thinking about how they apply it. And as already mentioned, how wide a range of experience should you have in the family-facing team? And I don't know, colleagues around the table may have a different view about what that looks like as well. I was trying to apply it in practice, really, and I was thinking about the context of where I sit in my local authority and about legal gateway, for example. So I think it's a really good example because the senior manager in me that's part of a current system that could be like, oh my God, loads of kids are going to end up coming into care, like that anxiety about decision making, and actually are people making the right decision, or a decision that I think is right. Actually, when I think about it, having chaired legal gateway yesterday, social workers pretty much are coming, and they know what it's not about me making a decision. Most people are coming with a really sound and robust decision and an effective plan. It should be more of a conversation rather than a panel of people and experts. And again, it's then how do we then bring in our legal department, people who are completely outside of the system, who are then thinking about the judiciary, how that works, thinking about actually do we have a designated legal rep for the team, and how we do legal gateway differently, having conversations that are a facilitated conversation rather than, okay, you're coming to a panel to have and make decisions. So I think I'll leave it at there.
Actually, the blueprint turns panels on its head, because what it does is invites the strategy team into the team, which is fantastic, I think. So kind of individual comes to the team for that discussion rather than individual social workers having to go and sit in front of a panel.
Okay, can I just ask you a question that's just come up there? So if this was to start, Katie's asked, would it mean a lot of redundancies, or would you expect managers and leaders to go back into direct practice? And I wonder if you could just reflect on that as a practice supervisor yourself. What are your initial kind of thoughts on that question?
Yeah, well, for one, I know it wouldn't mean any redundancies at all. But I was a social worker I've been qualified for 19 years, and I've been a first line manager for the last 7. So 12 years as a social worker, and I would thoroughly welcome the chance to get back into frontline social work. And I think a lot of managers feel similarly to me. I think you naturally fall into management positions because of the pay. Make no bones about it, really. Because of the pay structure, it's hard to sit at the same pay scale for 5+ years, and people naturally kind of move on, and then you start to kind of realise that you can still have an impact on children and families by supporting social workers to do their best work. That's how I manage as a first line manager, and feel that there's some purpose to my role in the local authority, but I would absolutely jump at the chance to become back involved with children and families.
And I think just to echo, and I think it resonates with what Dan was saying before about, the doctor or the dentist, still practicing. Like if you think about Eileen Munro and her vision for principal social worker, actually, I think personally, it's a personal opinion that everyone should continue to practice in some way, shape, or form, and that's the radical part of it for me. That creating a shift in people thinking, well, I do this role, so that means I do this.
I think Dean's right, and then just to say, we alongside Michaela and Dan and others, we spoke to a lot of team managers and those in kind of management positions, and we did actually hear from the majority of them that, as Michaela said, they would really like the opportunity to work with children and families again. I think some of the reservations we heard was around work-life balance, etc., and going back into practice. But we really hope, because of the way the family-facing teams work together, and it is much more collaborative, and we hope that they can navigate caseloads better and support each other better. Actually, the role that is in practice at the moment would be enhanced, and therefore that reservation hopefully would be lessened.
I think also it's about the narrative that actually, when people invite us into their homes, they don't have to do that. It's a privilege to be there, and that is one narrative. The other narrative is this is this terrible thing we need to get out of as quickly as we can, and we don't ever want to go back there. And I think we have to challenge that, because actually we came into everybody that qualified as a social worker wanted to work directly with people. And if you start to lose that, maybe you shouldn't be in that profession. Go and work in Tesco's or something else.
Absolutely.
And I believe that also, if you was to, obviously you will have more time, which means people think more, and you find that a lot of families get referred, and that process of the length of time also leads to them children going into care and delays and everything. Now, if you've got more time to be more resourceful and pull in all the tools that you need instead of always pushing out, then maybe those things that drag can get dealt with quicker, and you can bring in external collaborative approaches as well.
I think I just want to pick up on Joe's point there about kind of redundancies in the quote that is taken from the blueprint. I think just to kind of expand on that, I think that the point that we're trying to make in the blueprint around that is that this is a changing culture, because it's a high trust approach. It is trusting social workers to go out there and build relationships and to actually be immersed in the community. And what we're saying is saying that the majority of social workers would be fine in that they want to do this, that they should be trusted. And I think what we were saying is that there might be a minority who might not be able to do that, and we have to safeguard children and families and provide them with the best practice that we can. And I think this is proposing that if you trust social workers to go and do what they can, for the most part they will be able to do that.
I think it's about a new world where there's greater freedom but also greater responsibility, and I think just some social workers are not comfortable with that, and that would not be a job that they'd want to continue in, but I think that will be a very small minority.
Be interesting to hear what you all think on the chat box there. I know we've only got 8 minutes left, but this idea about kind of a different way of working, what from your experiences and where you work, what you think people would say, what will your colleagues would say, what would children and families say? Okay, so we've got about 8 minutes left, 7 minutes left, so we want to kind of encourage those last questions and spend the last 5 or 7 minutes having a conversation about your questions really, and also what next. So we'll just go to the final slide. Katie's just going to talk us through a bit about what the intention is going forward.
Yeah. So as I said, we very much put this out there as an idea that could cut through a lot of the issues that as Dean said, that social workers and local authorities and the government has been battling with for 30 plus years. And so the plan for us over the next stretch of time is to continue to listen, learn and nurture this debate around these ideas. So get in contact with me if you have any, I've seen a few specific questions on the chat about would IROs be in the insight team, etc., etc. Get in touch with me and I can answer any of those and we can work together on that. We very much want to build and convene on a kind of monthly basis the growing community of practice we have around this, which goes from social workers interested in just saying to their managers they'd like to work like this, to team managers who want to make some changes in their teams, to local authority leadership who have obviously more capacity in the current system to really reform how the system is run. And we'll be sending the link out in email after to join that community of practice, and we will convene them to continue the debate. And then we're keen to work and support any local authorities who want to pilot this at any level. Over the next 3 months, our aim is to get a few local authorities working on this and piloting this, and then getting them together to learn how that's going, and to convene them to understand any best practice. And we're hoping to work with our partners at Bertzog on that as well, because they helped us very much write the blueprint and can bring all that level of experience about how self-managed teams has gone in the Netherlands to pilot this. And that's our plan really, and we'll send out any information after my email as well as the community of practice link to anyone that wants it.
Yeah, and any ideas that you guys have in the last 5 minutes about what you think we should be doing next, please share that now. Oh, I was just about to read out a question and it's gone. But there was a question I was going to give to Dan about kind of how about... Are we able to scroll up? Sorry, I was scrolling up to a question that was just made. Bear with people. There we go, from Catherine. So, how are you going to introduce this to social work students and universities? What sort of placements will prepare students for a new way of working like that? I think that's a really interesting question. I'm looking at Dan because I know his practice educator background. Any thoughts on that, Dan?
I think practice education is a key part of social work, and the practice would remain the same. You know, we're still doing social work practice. You'd still be able to evidence your professional capabilities, and students bring a lot to the team. They bring a lot of learning. They bring a lot of ideas, the questions, and the eyes of somebody that hasn't perhaps been kind of jaded by 15, 20 years of practice is really refreshing. So I think it's a different kind of structure, but practice wouldn't be any different, would be my view.
But I think as well, within any team, you're going to have people that are interested in developing different areas of expertise. So you might have somebody who's more interested in practice education, so they might do the practice educator stuff. Someone might be more interested in some work around contextual safeguarding and what that means. And so I think there's still the opportunities within the team for people to develop individual expertise so they can support each other.
There was a suggestion up there, which is gone from the chat box now, but we have this saved, about coming to meet with a group of heads of service, which we're more than happy to do. So we'll kind of get in contact with you, and like Katie said, when the email goes out, you'll have our details of how to get involved. Just want to kind of pick up on Stephen's point there, Stephen Mack. He basically said, I realised in conversation with my manager how few decisions I was actually making at times, even when I knew what to do, because I felt that I had to run it past someone else. I think for me that kind of epitomises what we're trying to get across.
Yeah.
We're not trying to kind of make things more difficult for anyone. I think this idea is to kind of think about doing things in a different way for the benefit of children and families and for the benefit of the sector.
I guess it also a plea even now for managers to kind of start empowering the people they're working with to make decisions that are completely within their capabilities to make, and not, moving towards a supportive culture rather than command and control. I think that can be done now without launching the blueprint in a local authority.
So last 2 minutes, I'm just going to go around the panel here and hear some kind of final reflections. For those of you who watch Jerry Springer, like Final Thought, what was it called? Final Thought. So yeah, I'm inspired by that. So Jerome, do you want to start with your final thought?
I love this approach because it's about relationships. To me, how do you write about people you don't know, or do work with people you don't know? So giving social workers the trust and the power back to actually have relationships and make decisions will ultimately empower them, but also empower the young people, because right now it feels like social workers are kind of like children in care themselves. They've got no control, no power, and so we want to bring it back to love.
Dan?
I think I've been really inspired by Love Not Fear, and I think it's such a kind of a powerful idea. Actually, if we just care about people and we show them that we care, that's going to make a big difference, and I think that this helps us.
Thank you. Michaela?
I've been really inspired by the positivity today on all the questions and comments coming through. I mean, I'm a huge believer in the power of social work. I see it on a daily basis, people achieving amazing things with children and families, but it's kind of despite the system really at the moment, and I just think this approach could enable us all to do more of what you guys are all really good at.
I think for me it's just been a really inspiring session. It's great to see all the positivity on the chat. I think we're really keen to see how we can make this a reality at any level in a local authority, so whether that's a team manager level and just giving more responsibility, as Michaela said, or working with a local authority. So please get in touch and we'd love to work with you.
Dean?
I think for me, it's about the whole shift in language and moving away from risk to thinking about how we manage uncertainty and about how we get to a position of trusting our social workers to do what they do on a daily basis and having a position of safe uncertainty.
Okay, well, I just want to say a big thank you to the panellists here, and thank you so much for taking the time out. And like Katie said and everyone else said, that let's carry on the conversation. We might not agree about some things, but let's talk about it and let's get to a position where we can hopefully improve things for children and families. So it's bye from me and it's bye from the panel.
Bye. Bye. Bye.